Good morning, Namaskar. Good morning, everybody. This is Vinyasura Singh speaking for Bharat India, Bharat, and as usual, informing you, sharing with you the studies and updated status of COVID-19, strain, variant, etc. Title being Bharat India, an analytical informative talk on COVID-19 plus variant strain status for January 2nd, 2021, which has been reported on January 3, 2021, and Government of India, Bharat Sarkar provided data-based worked out spreadsheet, file, screen share for national awareness and everybody's awareness, and also for world awareness. We can say we are people of Bharat. We don't care about anything. That is our root, and we don't really like seriousness. We don't like any degree of seriousness, and we don't care really. I think we are always located far from reality, far from a scenery which applies to everybody except us, except ourselves. This is what I say because we do not want to do something if it is received from someone. I think there is ego with everybody here because speed with which we are moving, ours, or you can say our country, is moving to handle COVID-19 is really below much normal. You can say there's a normal definition, but this is much below normal, which also indicates that we do not care for our masses, for our subjects, which is really very serious issue. We do not care for 87% population or 86% population, whatever it is. We don't care for them, but you can say we cry and we shout and we issue bans that we have done excellently well. We always beat about bushes, but we claim that we are best in world. Yes, we are best in world for nothing, to be very frank. As nation, we claim that we are best, and we have done wonders when we reduce our daily COVID-19 positive cases to 18,177. It says that it's a come down from 19,000 and then come down from 20,000 and then come down from 21,000. Means it's like a fiction. It's like mirage. It's like horizon that we want to show to the world, which doesn't exist. That's what I have to say this. Before moving further on this, let me share with you yesterday's data, yesterday's statistics about reported cases of COVID-19 from various states as usual, so that you can update yourself. And this is here, state-wise, Bharat India, COVID-19 and status of 2nd January or January 2nd, 2021, reported on January 3rd, 2021, for purpose of resolution. How can we resolve this? So this is state, this is total cases. I'm going to announce several cases, though it's already announced on the website, but for sharing information, I'm transmitting this information to you. In an active cases, discharge cases, death cases only for show, and these are for analysis purpose. These three columns shall be used for analysis. Maharashtra 19.38854 lakhs, Karnataka 9.21128 lakhs, Andhra Pradesh 8.82850 lakhs, Tamil Nadu 8.19845 lakhs, Kerala 7.71252 lakhs, Delhi 6.26448 lakhs, Uttar Pradesh 5.87434 lakhs, West Bengal 5.54079 lakhs, Odisha 3.30117 lakhs, Rajasthan 3.09319 lakhs, Telangana 2.87502 lakhs, Chhattisgarh 2.81654 lakhs, Haryana 2.62850 lakhs, Bihar 2.52584 lakhs, Gujarat 2.46513 lakhs, Madhya Pradesh 2.43302 lakhs, Assam 2.16289 lakhs, Punjab 1.67012 lakhs, and Jammu and Kashmir 1.21471 lakhs, Jharkhand 1.15392 lakhs, Uttarakhand now it's down, it's below lakhs, it's thousands and hundreds, and Uttarakhand is 91,544. Himachal Pradesh is 55,619, Goa is 5,123, Pondicherry is 3,817, Tripura is 332, Manipur 2,824, Chandigarh is 1,986, Arunachal Pradesh is 167, Meghalaya is 134, Nagaland is 11, Ladakh is 955, Sikkim 591, Andaman Nicobar 49, Mizoram 42, Dadra Nagar Haveli 3, and Lakshadweep 0. This is, I can say, this is something I have to put percentage wise here. I just missed that one, no problem. I put just now. It's not a big deal. For purpose of analysis, I am putting this chart here so that we can understand what we are talking of. No problem now. And that chart is here, and also this graph, I can say, this graph that's here has to be copied, and I copied here for purpose of talk, and we can say, okay, I'll change that of that one, so that you can also see how I'm doing. It's interesting, means it's not difficult. We can put in here this data, and this data is here, let us say you put like this, here to here actually, not whole, and you say, okay, fine, we go like this. So when we say this data is this up to here, right? So, this is current data, and this depends on this. This is here that I did now, so that you can also see how I'm doing this. And because we have to decide about this data, which is potential carrier, which is a potential carrier for solution, if we can resolve this data, we can solve this problem. And this resolution is that at end, we need combat schedule or control schedule. This means we have to decide how we are going to handle this problem and in what span of time, that you call time scale or something, and how many stages are there on that time scale, which we call milestones. And we cannot fix these milestones and that stage or schedule without having data, further data, projections or determination, or you can say calculations. We cannot do this without that, and all material that is involved there, that comes from population of this country is material for that, and testing of that population is further refined material. How many tests are conducted, and what is status of treatment of those, and how fast, how rapidly can we move on that. That is what is required, which is so far not available, because this is a very long-term plan. What I understand is that which is unknown is up to 2024, that is 2020 to this problem appeared in world in 2019, and then accelerated in 2020, and now further accelerating, and it's expected that up to 2024 it will expand very rapidly, and then it will go on down curve, and that may take a duration of 2025 to 2029. This is what production is. This you can say scientific production by some scientists and also otherwise. So for that purpose, let us see how it's working, out of these three data, we can say if average has been taken here, you can see this is average, this is average, this is average, and this is sum of first and third average. This is combination of, this is, you may say here death plus what you can say active cases. We can say active plus death. Just for your purpose, I can write it. Active, sorry, this is active plus death. So we can say active plus death. This is that, active plus death. So I use alt enter, so we can do that one. This is what, so one more point added here for this purpose, and this is what it is, active plus deaths. And that's, sometimes we have to do it improvisingly. It doesn't make a difference, right? So this is active plus death. This is 3.4%, and this is average active, you can say here, and this is that. Or we can just put in something here, no problem at all. Okay, leave it down. This is active, you can just think of that, and this is that. We have just put this tally here, this chart here, from about data. This data, and this data. Well, this is discharge cases, so currently this doesn't give much worry for calculation because we consider these two. In priority, we'll consider this one first. This is that. We have now many months to go, and we have to consider how to handle population considering this hazard, because hazard comes from population, not from otherwise. And that hazard is to be resolved into conducting more and more cases, percentages, means testing percentages, and very rapidly we have to test them. So this population is very important here because we have very large population, so it's large work. It's very big work. First month, fourth month, then because we cannot consider every month. If you consider every month, it will be then different factor, you can say, factor of 8% each month, or you can say 0.08 rather than 0.28. Now in this case, I have taken quarter frequency, a gap of 3 months for every interval. So 1 plus 3, 4 plus 3, 7 plus 3, 10, 13, 16, 19, 20, 22, like that. This is every quarter it is. So we can say I added 3 months everywhere. 3 months is added, so that it becomes another, So it's that. Then percentage is here, and we can say this percentage is 1.2. Then I say 1.2 is in beginning, but you cannot expect that remains constant. It also gets some increment, and that increment I'm giving here in proportion to time scale. And time scale is that we are taking 3 months frequency, 3 months interval, which means 25% of a year and 0.25. So this factor goes to 1.2, that is this factor, into 1.25. So 1.5, which further goes to another 1.25, and 1.87, then 2.34, and like this. It moves to 2.93, 3.66, 4.58, 5.7, and 7.15. Mathematically, we have 130 crore population here. This is applied by government to very small population, and that is 17 crore 49 lakhs, which is 13.45% only. Is applied to 30.54, and they say this is a result. But about this, everything is dark. Nothing is being given in projections. So I want to take this rather than this. I want to use this value for, for projecting what is actually happening. That's the reason that we are taking 130 crore population as a whole, and we convert this 1.2% for this population, not only 13%. So this is that there, this is 140 something, but here is 1.56 crores. That's difference because of 1.2%, 1.56 crores, and then it comes here in this case 1.95, 2.44, 3.05, 3.81, 4.76, 5.95, 7.44, 9.3 crores. This is not a joke. This is exclusive on 1.2% cases, which varies from 1.56 crores to 9.3 crores. This range is very, very difficult. To be very frank, very difficult range, and you can say it's really, its range is not. You may say here, if you see this here, lower value here up to 9, so 9.13. So this is here. This is our death curve. This is death curve, right? So we have to be really very much, and this is here. You can say month-wise here. If you say this is month-wise here, then this I can see. You can see that one. So this is population as 100% survival. Now, only this is only this is very, 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 very troubling. Very, very troubling. It's troubling to everybody and to all. So we have to be very serious about this issue, and we can say, okay, let's say this is that, this is what I say is this chart, this is for this, that only. So you can say almost it's almost same, but on different pattern. So this is our 1.56 here, 1.95 here, 2.44 something here, and like this it's going up to 9.3. So we should understand this, what I mean to talk about. I want to talk to you, and this is that one. And you may say you can take down, it's no problem. You may take it down if you wish, so that it becomes permanent record. You can keep here, it doesn't matter, Let us bring it down here on this, just to see how it works. You can say it's here only. And we have to understand how we can use this data. This is there now. I want to use combination of that and this point. With that, I can say I put, instead of 1.2, I change it to 3.48, so that everything changes. You can see here, this is a timeline, and this is your, how it works. It goes to 26 point something, and it's going above that, and here is this. It's working is very, very troubling to everybody. This is on similar pattern that government data is. But I don't believe in data, but yet for calculation purpose, for analysis purpose, for conference, we can consider this currently. And this could be different also. They say 3.48 companies, I may say 8%, maybe 5%, let's consider 5%. If I say 5%, how shall it work, It shall work, see how it's going, It's going very, very troubling now. It's going very, very troubling. You can see that's the point we have to consider. So I just purpose only to show how data moves, how projection moves, and that's very troubling now. So we go back to 1.2. 1.2 here. Now, we have seen how in future this criticality will move. If we consider minimum loss of 1.2% only, this is figure, and if we add to other one, we know what is figure. You can see what is figure here, and how many crores of deaths. Varies from 4.52 to 26.94 crores could happen in our country. That's what we are talking of, and for that, public should demand control schedule, how to control this problem, how to suppress this problem. And I think suppression should not be used. We should say how to prevent this risk if we consider this risk. To be very frank, I consider this sheer risk. This risk is very, very dominating on us, and we have to think about how to handle it, because risk prevention is better than risk suppression or problem suppression. We say, yes, there is loss indeed. There is going to be loss, certainly loss to humanity. It's not loss to property, loss to humanity. And loss to humanity is more serious than loss to property. If so many crores people are at stake of death, so what are we doing? That is my question. If till now, in more than how many days? More than 300 days, that is about, in more than 300 days, we could not even develop. In 309 days, we could not develop. We could not develop anything for solution or for even understanding what level of risk do we have, and what sort of professionalism we have, That's a question mark. Big, big question. Many questions are there. Why are we not concerned about population? That's first question. Are we leaving our population into ashtray or into dustbin, or we consider them garbage, or we consider them of no value? So many questions appear there. They may be taking care, is given on their website, a very good care they are taking. I don't know what care they are taking, only they know, but they claim that they are taking care. They are taking care everywhere, and that's really worrisome, what degree of care they are taking. I don't know, website says, I cannot show you that website, but I can read that message for you. I yesterday also read. It says that Government of India is taking all necessary steps to ensure that we are prepared well to face challenge and threat posed by growing pandemic of COVID-19, coronavirus. With active support of people of this country, Bharat, India, we have been able to contain the spread of virus in our country. This is what they are saying. We have been able to contain the spread of virus in our country. I don't agree with this. This is just, self-foolishness, self-deceiving. Most important factor in preventing the spread of virus locally is to empower citizens with right information and taking precautions as per advisories being issued by Ministry of Health and Family Welfare. This is what government says, and I do not accept this as citizen of this country, because this is deceiving statement. I think, where should I write this statement? This Excel will not allow writing. Even if I write here, it won't give what I think. Well, I just write for your reference. I'll delete it later on. What it's saying is just because I spoke, you can say, it says that Government of India is taking all necessary steps to ensure that we are prepared well to face challenges and threats posed by growing pandemic COVID-19. Coronavirus, with active support of people of India, we have been able to contain the spread of virus in our country. Most factor in preventing spread of virus locally and citizens of this country, whatever it is, and the Ministry of Health guidelines are there to free. All this just for purpose of formality. I think it is written, and there is no purpose otherwise. They just write for this purpose, and I think it is nothing but only deception. So you can say, it's okay, fine. You can say, hey, I guess okay. If you take like this, no, it's not coming in. Let me see how it can come. I don't know. So, okay, I put in this cell, no problem. It works here. If I can cut here and put here. I think it's better to, no problem. This way is not a problem for this program. It will stay here, no problem. Okay. So it says, I should put something here, I think. It's better to be here only. So government of India is taking, you can say, all steps, and we are prepared to see this challenge led by government. So this is what does this say? Well, let them say what they say. What people say, what intelligence say. Intelligence are not saying anything. This is very regretful. This country is full of intellectual people in crores and not in thousands and not in lakhs, in crores. And I think they understand very well what report comes, but nobody cares. I think they do not intend to read that report and go to that side and see or analyze that. That's unfortunate, to be very frank. It's really unfortunate that we, we, we can't have that much capacity. Well, I'm not criticizing anybody here, but we should know that we are part of society. Everybody is member of our society, and until we have this schedule, we cannot do anything. We can, until we are charted in, we cannot do anything. And this period is very, very complicated here. Coming, you can say, it's now 21, coming 8 or 9 years are very complicated, very risky. So this part I cannot resolve. We can only give some hints that I am giving here, as I said here, this, and you combine these two, and also we have to see those discharges are not free of COVID. Sometimes you are discharged just because protocol is there, but it doesn't confirm that you have got rid of COVID, and that is very important part. So we go back to sheet now, sheet of information, and the sheet is also very, very, very important. That now, because serial number is widening, so I use some special serial as well. Now this data which I am giving to you is based on, this is serial number of day, report date, it's here, and these are about, how many we have crossed. We have crossed 106 days, 106 entry into this data. It is more than 3 months, you can say 309 days already there, and we started this on 31st August this year. Then we can say here is population management, 130 crores we used, and this data is not necessarily 130 crore because you can change if you think it's not 130 crore, but for purpose of analysis, I considered 130 crore as datum line for conducting this analysis. And this is percentage daily tests in relation to population, which is very, very small. How many tests do we conduct every day? And then what is population? So every day it's too low. It's yesterday it is 0.074%, and that before that day was 0.064%, and before that was 0.082%. And this column is given by government. All these yellow columns, highlighted columns, are containing data copied from government website. So this is total test update. Total test update means how many tests have been conducted so far, and this is figure for yesterday update, which is 17 crore 48 lakhs 99,783. 17.49 crores. After that, we have here two columns, which these are for, you can say, percentage of total tests done over population. How many tests we have done, and what is population, percentage of that, and then remaining population percentage. So it is, you can say, we have done 13.454% tests of population till yesterday, and remaining are 86.546. Now these tests, I cannot say these are planned tests. These are just those patients reaching hospitals or reaching laboratories or reaching test centers. That is collection of the data here, a reflection of that data here. I don't think there's a certain scheme from government. There's the access, no scheme from government according to whatever data we have. So this is, you can say, natural, or you can say by virtue of time. We say that 13.454% population has been tested, whereas remaining population lies without tests. I don't know reason for that. So 17.48 crores only out of 130 crore, and that is 13.454%, and 86.546, which is 112.5 crores, stay without tests. And you can see here how many tests we are conducting every day. We are conducting in 309 days we conducted so many tests. So if you see here F110, it says divided by C, this value, and it goes here, or both are same. So this is 5.66 lakhs tests we conduct every day on, considering if you consider number of days spent on this test. Okay, in beginning it was of course very little, but now it should rise, but it's not rising, unfortunately. So 112.5 crore people have not been tested. Whether or not they shall be tested, I cannot answer. Then we go to another one, and that is here. You can say daily tests conducted, how many tests we conduct every day. This is that one. This is independent data. And yesterday we conducted 95, 81, 25 tests. Before that, 8,29,964, and yesterday 9,58,125. Then let's some increase, but still too low. Now, how much increase there in these 2 days? We can say here how much increase is there or decrease. Let's say plus, we can say here plus this value minus this value, and parentheses are closed, then divided by this value multiplied by cent, and we can say 15% rise in these 2 days. It's nothing. You can drop or rise. I cannot drop or fall, or rise. I can say whatever it is. So we can say rise also, just to be justified, because there should be no partiality in something. So it's down, drop, rise. Okay. So there's 15% rise in this case. Still, if you consider previous day, that is 10,62,000, and then previous to 11.2 cents. So if you consider last 4 days, if you consider this entry, this one, that is 103. So if I say 103 entry here, so 103 minus, let us say 103 minus this, and then we see how much it is. So there is 14% drop in these 4 days, and that is worrisome. Let me be sure about this. 103 minus 109, 103 minus 110 actually, not 103. I'm taking this value. Oh, no, 107. I made a mistake. 107, sorry. 107 here, and we say 107 is this value here, and this is 110. So it is 110. I think previously also may be wrong. 110. 110. Yes. Okay. And divided by this value of 106. So this is 15% here. You see in this date, 30th December, and there's a drop of 15%, whereas there was a rise in this case. This drop is mere come because we were doing a little better, but now we have come down. Yesterday was too bad, today is a little better than yesterday, and still it's not too much, because at least 11, 12 they were testing before, now they are not even testing that one, though it should be 1 crore or 62 lakhs, but we are far behind. This point we have to understand. So, because rise is also not that big. If you consider rise, you would say it's also not big. It is 105, 106, 106 minus 105. 106 minus 105, we take this way, 105, and then we divide by 109, 109. So we get a value of 16%. So it's like that. So in the last 16%, if you compare to yesterday, there's a rise, but there's still a fall of 15% in last 4 days and more than that. Well, just for your information, I'm giving you this. So yesterday, 9,58,125 cases were conducted for testing, and total population here that has been tested according to data infection, total infection so far. This is that one, total infection so far. That is here 10 crore, 1 crore, 1 crore 3 lakhs 23,965. We have reached so many patients till now, though it's very low, but this is data, we can't help it. And they say that yesterday, this means one day, individual day patients, daily, you can say daily tests, daily positives, and daily positive here is 18,177, and this is what they consider very important figure for them. This they consider a mark of pride on their forehead. This is what they consider, but I don't consider this that way. It's different one. It's not that. It's stupidity. We say that it's worrisome. It's very important, and this is your deaths update. Total number of deaths so far 1,49,435. Now come on to this point. This point is very important because so many, you can say, how many tests were conducted and how many people were exposed. We have to see that way. If you consider that one here, this one, it says M110. This is updated data. M110 is here. This is here. Number of cases that were positive and total number of data is I here. We have to divide this value by this value to find percentages of how many people were tested and how many were detected positive. So this is 1.9%. In previous case, it is 109. It is 2.3%, and previous 1.89%. So average in last 3 days is 2.03%. So 2.303 on individual basis on every day we have positive tests. So in this case, if you say, just imagine if 130 crore people are tested in one day, so 2% is how much? You can understand yourself. This is 2.6. 2.6 crore people can be, you can say, can be detected positive in one day according to this data, and that's my point of view. So you may say that here, I'm not using this term, I'm using this different portion here. So we can say here that we can say plus this into 130 crores, and this is 2.03 into divided by 100, of course, divided by 100, and we can say 2.6 crores. It is in crores actually. It is in crores. It is in crores. So 2.6 is very some figure. 2.64 crores, and this is percentages, daily percentages we can say. So this is daily percentages actually. These are percentages, we can say percentages. Daily positive percentages. This is daily positive percentages. So you can say so many, we have this average actually. This is one day, this is a current day, this is one but current day, and this is two but current day. So average is 2.03, which is 2.64 crores. This point you have to understand very well, and this is where worry lies in. So daily this can be 2.6 crores, which is very some figure here, and we should consider it in a different way. Otherwise we cannot understand this problem. Now considering all this data, what we can say? What do you think it is? That's very important. And it simply says that we are not serious, we are not regular, we have no punctuality, no regularity, and it means sleeping, non-serious, failure, drastic failure, no interest, no policy and no change in policy, and seriousness does not exist anywhere. So let me go through what I posted with best wishes in 2021 and followed by that report of this day. And you have to see there are about 29 URLs of posts in text of this video. These post URLs, if you want to see previous posts, I can say 29 days previous post, you can see there by going through these URLs which are available. So if you want to see past data, you can see, you can find, because you cannot find on government website. And also there are about 42 video URLs followed by post URLs which give you various informations for last 42 days videos. And then I read that COVID-19 strain variant report date update on January 3rd, 2021 forenoon. Bharat public must think very seriously about how to achieve risk or loss prevention by application of required pertinent measures in relation to COVID-19 plus explosion, because nothing is being seriously done by our nation. Building always remains prone to fire. You can say that, I'm sorry, you can say building always remains prone to fire, and we have to think this way. I'm just giving you information about this data which I'm reading, though it's available there, but just discussing with you is better because it's difficult to read all time. I can say building always remains prone to fire. What does it mean? Generally I'm talking building, because building is the only structure in your life that for which you struggle a lot. And if you have a building of your own, you think that this is something great for a normal citizen. I'm not talking of riches, but for very normal subjects like you and myself. I say building always remains prone to fire, but if loss prevention methods are applied, losses to life and property can be minimized. So this also applies to COVID-19. हाँ तो इन्वर्स कर रहे हैं ना. So what I say is building always remains prone to fire, but if loss prevention methods are applied, loss to life and property can be minimized. So this also applies to COVID-19. This is very important noting, because building is very expensive and your lifelong for many generations it's used. Same thing is COVID-19, which is also very expensive, health hazard, and it's hazard. This hazard is very expensive. You have to solve this hazard. This is, if it goes out of your control, it's a big hazard of life, to life and for others. Also, it is very serious. So if you care about this, what I say, don't worry about this. Just think of loss prevention, how much loss you can get out of this hazard. And if you take preventive measures, then you can benefit. So possible magnitude of risk must be understood. Magnitude of risk must be understood or evaluated by analyzing its power, and then based on analysis, practical applicable solutions must be searched and finalized prior to it is too late. That is what it says. Now, COVID-19, let me put up that site first, because there's no need of that site. We are not unnecessary. There's no light as well as, just a minute please. Yeah. So I put up that site. Now, what I'm saying is, you can say possible magnitude of risks must be understood or evaluated by analyzing its power, and then based on analysis, practical applicable solutions must be searched and finalized prior to it is too late. COVID-19 strain variant has already spread in many countries, such as you can say, namely Bharat, Canada, UK, Australia, European areas or countries, Singapore, Hong Kong, Sweden, Jordan, and many, many more. I can't name all. Bharat, India had crossed many days back 2020, 1 crore COVID-19 cases, and also many cases of variant strain have been reported from various parts in Bharat, India. Individuals out of 130 crores, only 17.489 crores or only 13.454% population has been tested, and 86.546% population certainly remaining untested. No worry for even COVID-19 strain plus in Government of India on people of Bharat, India, as mostly people of ours have become sheer careless and ignorant. No plan is available for remaining 86.546% population who have been remaining untested, which has made it impossible to fix certain required milestones and work out schedule, prospective time scale based plan to combat COVID-19 plus impacts. Testing speed has been non-conducive, extremely unsatisfactory. The real state of future of COVID-19 in Bharat, India cannot be correctly either forecast or predicted analytically. In this connection, I had sent mail many days back in 2020 giving many above URLs to Government of India, which email acknowledgement was received but no further response from government received, and no other planned scheme informed by government, and it's not expected anymore either. No change or accelerating program is visible, no projection of any program is visible, available. In fact, testing speed has been still really outstandingly unsatisfactory. No reported education seems to be on part of government to an extent testing on whole population is related or concerned. Government doesn't take any responsibility for testing of common citizen. It's assumed to be responsibility of citizen to have a test done if one feels that it's affected, symptomized by COVID-19 plus. Government has distanced itself from owning public health responsibility. Total tests conducted up to 2nd January 2021 is 17 crores 48 lakhs 99,783 only. Tests conducted on January 2nd, 2021, 99 lakhs 58,125 only. Total corona infections till January 2, 2021 equals 1 crore 3,23,965 according to government statement. Only so many, they say, positive cases declared on January 2nd, 2021 is 18,177. Only 18,177, and I say that is manipulation of data while government claims that this is achievement. So let them claim, I don't mind that. Death update till January 2, 2021 is 1,49,435 and population test is 13.454% only since March 2020, 305 days or more. Remaining population without test is 86.546%. Time required for whole population testing is 1276 days, while remaining population shall consume 1,104 days. Now this period 1276 to 1104 required days admissible to people of this country, whether public has to accept it or public has to reject it. Public has to consider this point very seriously in national interest. Why is Government of India not improving its bad performance? It's not clear yet. Government does not respond and shall not respond at all just to protect its own skin. Government has very thick skin, I think. Government has actually ignored poor, lower class society members from testing. Why is government sleeping? No answer exists. And public too sleeping? No answer exists. Unknown worry, less state of public. We don't worry at all. That's called worryless state. Then government does not look anxious to test all citizens. testing speed is too slow, too low. Why should people of our country, Bharat, India, suffer for none of their faults? Only sufferers are poor people, poor sections in society who cannot afford treatment. Why are suffering people not raising their voices? How people become voiceless? People of Bharat, India are not living as slaves but have become virtual slaves of current Modi's regime. Why has government not left its responsibility onto people, onto their own expenses or their responsibility? It seems that all people shall not be tested because till now no such policy seems to exist and no addition to as such in non-existing policy of government has been observed. Really speaking, there exists no government policy towards public handling of COVID-19 strain plus have tested yourself, conduct test yourself, dear poor members of society. Poor people, if you intend to be COVID-19 tested, do it by your own expense because no government exists for you. You spend 1200 to 2400 rupees for testing one time. After testing is over and having detected positive, pay for your treatment as well, along with medical assistance cost. Remember, medical attendant charges 1500 to 3000 per day. If you isolate in your room, all expenses of attendant, food, board, and lodging you have to afford. You have to buy protocol-related medicines, injections, oxygen, if required, pay for ventilator as well, and all PPEs necessary for attendant. If you stay in hospital, room rent itself could cost you around 10,000 to 20,000 rupees per day, a minimum. Therefore, be ready with many lakhs rupees. People shall have to decide for themselves, for there exists no one responsible for you from government. COVID-19 virus explosion has to happen and is happening. Come what may due to inefficiency and sleeping attitude of government and lethargic people of this country, COVID-19 shall certainly explode in this country, Bharat, India, in form of COVID-19 plus variant strain nuclear fission. A nation where neither public is serious nor government is serious. Nothing other than anticipated explosion would happen. A society that remains non-serious and on top of that sleeping too shall have to face those offending adverse results for sure, for certain. A nation that cannot think to resolve problems seriously, such results are imminent thereat. Nation cannot wait for many years to have preventive implementation from impact of COVID-19. Out of my understanding, the 1.3 billion people, including many crores intellectuals, but lips are stitched perfectly, they are unable to speak. And therefore, I say speak up, all to take necessary action, because government is in totally lethargic. People must think for nation and not government. Government is trying to ignore COVID-19 by diverting issues. Think to get a working government, not current sleeping one. Let them work. They force them to work. Chowkidar political guard can also sleep and often sleeps. This data which I spoke is written already on text, some of them missing. No problem, I have spoken to you. It's very important one from viewpoint of. And you can see this routine graph which is telling a lot story to you. It's telling a lot of stories and it's nothing new in that, but it's very horrible if you see this graph. Horrible in a sense that there is no perfect curve for this that can represent certain good state of this hazard. It's just up and down, valley, hills, valley, hills, valley, hills, valleys like that. And you can count many more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, so many you can say, maybe more than 20, 25. Means there is no ground level, there is no fixed slope on this, and we cannot say, they are just showing is down, down and down, but facts are telling the situation is not down. We have to think very seriously. 9 crores are expected from this data itself, and because it's only for 13.545 representation, whereas 86 are left, means about 8 times, about 7 times or 6 times, 7 times people are left. This means 9 crores possibilities are there of infection so far, and our calculation says it is 35. Because this data is not exact, all people are not coming for tests or they are not being pulled out of homes. There's no policy, government has no initiative towards them. Therefore, we can say that it may be between 30 to 40 crores currently, and we should rise more. And here is, sleeping status, and it says nation has to face nuclear fission, COVID nuclear fission soon if we sleep together for long. Because this data is telling something, you can see this data, it's telling something here that these are 3 days, 1.89% one day, 2.3% one day, 1. Last 3 days average, and average is 2.03. This is individual days, this is average. 2.03% people out of those tested are posed, or they expose themselves, or they declare themselves, or they are declared positive, and this is 2.64 crores if we convert this percentage into population. So 2.64 crore people are there in this area, and that's what do you call here. We have to be very serious about this matter which we are ignoring. We should not ignore this. Ignorance will not work. Seriousness shall work. And solution is we have to understand what we should do as a nation. As a nation, we have to understand what I'm saying is that one. Yes, what do you want? Hello? 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 Yes, what do you want? What do you want?
Hello.
Hello? Hello? I'm online. Yes, what do you say? Hello? Hello? He's not speaking anything. Hello? Hell with you. I'm wasting time for nothing. I'm sorry, gentlemen, people disturb. What can I do? If I take line, if I receive line, there's no interaction. If I close, then they mind it. I don't know why people, they know that I'm talking, messages with them, but still they are trying to interfere. Only solution to this problem is, we have to always see where is the root. You want to solve some problem, you have to find root of that problem. And problem says, I am here. If you see this blue cell, problem is here. First requirement is we should know how many people have been impacted upon by COVID, how many people have been exposed to COVID or contracted COVID. That is first requirement to know. The second requirement should be how shall they be treated? What level of treatment we should provide them and impart them with, or this is second requirement. Then we see what best we can do for all society who have been discharged or who have not contracted yet. So there are 3 stages. Stage number 1 is testing. We have not done to requirement. 309 days have gone, only 13.45%. So you think of, and this status is telling that you require more than 1100 days. Is that practical? I don't think it's even imaginary. Calculation is telling that, but it is not practical solution. How can you wait for 3 years, more than 3 years? No one can afford this. No government in the world can afford this. How can we afford this? Because we are a big population. If we wait for 3 years, I think it will multiply and multiply and multiply and multiply, and you may say more than half population would be infected. Can you afford that? We cannot afford that. So what is solution? First mistake is that we are not thinking on how to test all. No policy seems to exist Maybe there is, I do not know, there is no publication of that. This figure of 13.45 should be at least 50% by now because of the 309 days. If you cannot do it 50% in 300 days, we cannot do anything. So here is lapse, it should be 50% by now. So it should be 4 times, you can say it's 1/4 in that case, right? So how to handle this? How to control 87% population from impact of COVID? Only way is that whatever resources we have today, we have to bring additional resources number of times of what we have today. Say, only way is we should fix a period that 3 months to 6 months or 3 months or 6 months, depending on our seriousness. If we start at 3 months, let us say, if we start at 3 months, we require resources 12 times because we have to finish in 91 days, not in 1104 days. I am interested in this, and if as a nation we can hold this to 12 times resources, it may be in private domain or it may be in government domain. It depends. But I think our people cannot afford private domain, so government should take over private domain and handle this case. If you want to prevent hazards, if you want to prevent risk, that's the only way. Multiply your resources by 12 times so that you conduct 1.23 crores cases per day. Can you test them? That is first position. Or you say, okay, it's too much. We just take a grace and give 6 months to you. Okay, 6 months period. Those 6 months is also very, very critical. But even then, something is better. So you can say you have to multiply your resources 6 times, existing resources, and it gives you 61.6 or 62 crore testing cases per day. 62 lakhs, not crores, slippery of tongue. 62 lakhs testing per day. So this means a range of 62 lakhs to 125 lakhs. Yeah. If we can manage it, means in 91 days to 183 days, 91 days to 183 days, if we can manage this, we can handle this problem. But that is only for test purpose. Only for first question, how to do it. Second is treatment. If we can find solution to treatment of those we detect positive, itself be nice. Means we can then say we are a great nation, we are world leaders. But we are not world leader even in testing. We are falling far behind. Far behind. See England, what they are doing, they are testing all students in couple of days. Because they are serious, we are not serious. Only country in world is ours that doesn't work, that is not serious. Clearly this that I was telling, I'm not concerned with what government says. They say only 18,177 positive yesterday. This is out of how many percentage? That's point. So we are sitting on volcano, you can say COVID-19 volcano here. And if you do not take care of population testing, solution cannot come in. You cannot find solution. That treatment is a bigger one, bigger problem. First is your testing speed you have to increase. That's only way we can do something, and then think of how to treat people, because treatment is also very important. If you do not treat, this will become more and more serious, and you have to provide then oxygen and ventilators to many persons of them. At initial stage, if you find, you can just get rid of in isolation for 70 days protocol, and maybe medicines you provide to them, and maybe oxygen may not be required, or a ventilator may not be necessary because it is a mild stage. So it is better. Otherwise, those people who have no immunity and who have caught COVID, irrespective of they are not in records, they may develop strain or variant. which is approximately double impactable to everybody. And if people contract strain or variant, for sure they won't exist, because those who are patients of COVID strain or COVID variant, they shall certainly expire one day. COVID-19 is still safe, means you can say I'm discharged or I got rid of isolation. Only few percentage people who are in advanced stage, they die of COVID. But everyone who is impacted upon, who is contracted by COVID strain or variant, or I call it plus, of course, for sure, 100% there will be casualties. So we have to be very serious. Today, you may not think it is a serious issue, but it is very, very, very serious issue. I say that is very important. Testing speed could be increased to 1.25 crores. There is no problem. We have a large government, very big organizations, very many ministries, very much private sectors. Why not government use them? What's the problem? Just collection of money you think is okay? You just keep up collecting funds and spending here and there and giving aid to that country and giving aid to that country and doing nothing for your country. Is that right? I don't understand. You don't have any statistics about how many people have contracted COVID till now. Shame on citizens of this country who do not care for. And if citizens do not care for, government shall never care for. And this is where we are standing now. I cannot say anything more surprising than this. In fact, it's a very serious issue, and we have to be very serious. Every citizen of this country, belonging to whatever class, irrespective of class, one should be serious. I'm weaving a big problem, volcano of problems of COVID-19. Means we can reach a stage that you cannot even handle it. Because we are the biggest country. Suppose we have 30 crore people, patient of COVID-19, simultaneously, 20 crores simultaneously, 15 crores simultaneously. How shall we handle? Do we have infrastructure of health care? We don't have. Do we have so many doctors and nurses? We don't have. This means we shall have no solution except to loosen health or loosen life. It is really very serious, extremely serious. If we do not take into our consideration at this moment now, we shall never reach solution. And then we have to think of those who have been discharged or shall be discharged. Shall they not be recaptured by COVID, recontacted by COVID? Shall they not be, if suppose they do not develop immunity to required level, then they can contract strain or variant. And if they do it, it's a big issue. Means they got discharged from COVID-19 isolation, but they are recaptured, they recontract COVID-19. I'm to say COVID-19 variant or strain. In that case, though they were discharged, yet they are prone to death. That is very serious matter. We should not be happy that 90% or more have been discharged. We say, oh, see, we have discharged so many people, and we are very, very happy on that. We are claiming, see, we have discharged. What says in that sheet? You can say, in this sheet they are saying that here 93.7% people have been discharged. These discharged, if they do not develop immunity, if they fail to develop required immunity, and variant or strain comes to them, what shall happen? Nose shall be in problem, nose shall be troubled. You can say eyes shall be troubled, lungs shall be troubled, and this trouble shall go to final terminal. Final date of expiry? It's big question. That's the reason that I'm trying to communicate to all existing problem, because it's going to come. It's going to come. You can't avoid it. If whatever speed it is moving with, it continues, and whatever speed we are not testing shall cause problems and problems and problems. So my dear friends, it's not always worthy just to think everything is okay. We are normal society, we are non-scientific society, non-engineering society, we are non-serious society, we are non-awakening society, because we are not serious, we are sleeping after sleeping, and we are carefree. And I'm worried for those families who are poor, who cannot think about all these issues until water comes on their nose and eyes, or you can say they are drowned in. It's therefore very very easy to say that people actually don't like my talks only for this, that they think I'm criticizing state, I'm criticizing government, and they consider something else which they should not do. It's not Khrushchev. I say I'm nothing to do with all politics or all government. I'm just trying to disseminate my mind information to them. What I think may happen, it may happen. हो सकेगा ऐसा हो जाए या ना हो जाए मैं नहीं कह सकता. आज की जो हालत है कोविड-19 की, वेरिएंट की और स्ट्रेन की, बहुत खतरनाक हमारे देश के लिए, क्योंकि हम टेस्ट नहीं कर पाए हैं, जो कि एक बहुत बड़ी प्रॉब्लम है. जब तक टेस्ट नहीं हो पाएंगे, सबके 13% के हुए, 87 के नहीं हुए, तब तक हम ज्वालामुखी पे बैठे हैं. ज्वालामुखी कोविड-19 का, स्ट्रेन का और वेरिएंट का. इस ज्वालामुखी पानी से नहीं बुझा सकते, कुछ नहीं कर सकते हम. इसलिए हमको सोचना होगा, समझना होगा, करना होगा कुछ. रोज रोज बात करने से तो कुछ होगा नहीं. आपके 13% टेस्ट में आप चाहते हैं सोल्यूशन मिल जाए, नहीं मिल सकता. हाँ, 87% टेस्ट हो गए होते, 13% रह रहे होते तो बात कुछ और थी, तो शायद मैं ये वीडियो भी नहीं होता. मेरा वीडियो बनाने का जो पर्पस है, इंफॉर्मेशन देना लोगों को, और सच में ये जो क्रिटिकल स्टेज हमारी है, इससे बाहर आना, जो कि और अगर हमने कोशिश नहीं की कुछ दिन, तो शायद केस बिगड़ जाएगा हमारे देश का. हम लोग फंसे हुए हैं, उससे बाहर आना है. और ये फंसे हुए से बाहर आना देश की पॉपुलेशन की, देश की जनसंख्या की, देश के लोगों की जिम्मेदारी है. क्योंकि देश के लोगों को प्रॉब्लम होगी, सरकार को तो प्रॉब्लम नहीं होगी, वो तो बड़े बड़े अस्पतालों में जाके अपना इलाज करा लेंगे. लेकिन जो गरीब लोग हैं, उनको प्रॉब्लम होगी, उनको बचना होगा इससे. नहीं तो बहुत गलत, बहुत अनएक्सपेक्टेड रिजल्ट आने वाले हैं अगर नहीं संभाले हम. ऐसे रिजल्ट जो आप कल्पना भी नहीं कर सकते होंगे. फिर आप कहेंगे देखो किसी ने बताया नहीं, सरकार ने कुछ किया नहीं. आप स्वयं सरकार की जगह काम कीजिए, अपने को संभालिए. खर्चा तो होगा, क्योंकि सरकार तो पैसे देगी नहीं आपको. खर्चा तो आपको करना पड़ेगा, नहीं तो आपको फिर भुगतना भी पड़ेगा. भुगतना इसलिए पड़ेगा क्योंकि अगर कॉन्ट्रैक्ट हुआ आपका कोविड से, तो कोई आपकी सहायता नहीं कर सकता है. ये बहुत बड़ा इश्यू है. इसलिए बड़ा इश्यू है हमारे लिए कि हमारी जो जनता है, उससे पॉपुलेशन है बहुत ज़्यादा है. हमारी जो पॉपुलेशन है कई देशों की मिला दें, अमेरिका की, इंग्लैंड की, कनाडा की, और आप कह सकते हैं पूरे यूरोप की भी मिला दें तो भी शायद हम ज़्यादा हैं. अरब की भी मिला दें उसमें, अरब जो कि बहुत छोटी पॉपुलेशन है, 6 कंट्रीज़ की, 6-7 कंट्रीज़ की, तो वो सब भी मिला दें आप, तो हम तब भी बहुत अधिक हैं. और यही मुसीबत है. हमसे ऊपर चाइना है, लेकिन चाइना आज की तारीख में पीछे नहीं है कोविड में. اسے مقابلہ کیا اس کا، لیکن ہم لوگ سوتے رہے اور اپنی راجنیتی میں ڈوبے رہے۔ اس لیے آپ باہر آئیے راجنیتی سے، بھول جائیے راجنیتی کو، اپنے کو سنبھالیے۔ اس کے ساتھ ہی میں یہ ویڈیو سماپت کرتا ہوں۔ آپ سب کا دھنیہ واد۔